Good afternoon, everybody, and thank you for joining us. Right now, Nebraska medicine is looking for extraordinary people, and that includes nurses in our emergency department. My name is Kayla Thomas, and today I am joined by Suzanne Watson, who's the nurse manager for the ED, as we call it around here, who's going to give us some more information about what it's like to work in the ED and exactly who we're looking for. So, Suzanne, first of all, thank you for joining us.
Thank you for inviting me. This is awesome.
I had the opportunity to see you earlier today. It's the first full day that we've been able to give out the second dose of the COVID-19 vaccines. And a lot of members of your staff in the emergency department were able to get those doses. So I just want to start off there. What's it like to be able to see your staff be able to complete the vaccine process?
Well, I think it's really exciting. A couple of them, we talked about that because it gives us a lot of hope, because so many of us, like everyone else, want to be able to get back to what our normal was. It may be a new normal, but just to be able to feel like you can maybe interact with some family members that you haven't seen in a long time, or friends that you haven't seen. And also, just the patients, the number of patients that we would have to see with COVID, hopefully will go down, because it's been very hard for everyone that's been caring for COVID patients, and not only the patients but their families. So it just kind of gives you a lot of hope, and I'm very excited that we're able to get our second dose, and hopefully everybody does very well with it, because so far it's been good.
That was just exciting to see. And I think the emergency department, you're there to care for whoever comes in the door. And these are people that are coming through often on the worst and the scariest day of their lives. What's it like to work in the ED?
Well, I have been in the emergency department since January of 1992. And if I didn't love it, I wouldn't still be here. It is, we see every type of patient. And so the wonderful thing about the emergency department is that you see something new and different every day. You care for patients of all age groups, from newborns to geriatrics. And it is exciting because you take care of people sometimes in the worst moment of their life, but you can really make a difference. When I have new nurses start, I always tell them that it is, particularly if they came from an inpatient setting, is that in inpatient, you make a relationship over time. In the emergency department, you have to learn how to make a difference in moments. And that is really what it is. It's making a difference in that patient's, hopefully making the worst day of their life a little bit better.
I grew up watching ER, and I think that's the experience that a lot of us have is the TV shows. So we think about things like car accidents or gunshot wounds, but the extent of who you see is wider. And you mentioned patients of all ages, but what are some of the conditions that you're helping to treat?
Well, we do. We see minor things to very critical things. So we have an area of the department which is called Fast Track, or our rapid assessment area, and you'll see patients with um, kids with ear infections, broken bones, cuts that need suturing, people with abdominal pain. We see strokes in the main part of the ER. You'll have heart attacks, people with appendicitis, or bowel obstructions. You kind of see everything. And that's the beauty of the ER, is that no day or no hour is the same as the previous. It's all very different. You have to be able to adapt quickly to what's going on. And you have to learn a lot about a lot of different things. And so that's kind of what the exciting piece of it is that we have a great environment as far as people who like to teach. And so whether you're a tech or a nurse or a respiratory therapist, the physicians and the residents and the pharmacists are always willing to answer anybody's questions. So you're kind of always learning. And that's also one of the exciting things about the environment.
COVID-19 has had a huge impact on lots of areas of the hospital, and very significantly the emergency department, because you don't have time. You need to get in there and care for these people as quickly as possible. So how has your team adapted, and how has it affected operations?
We've had to change a lot of things as far as how we operate. We have had to do a lot of training on how to keep yourself safe, because it's not going to help anyone if you run into a situation and you haven't adequately prepared yourself and wear the correct PPE. We've seen a lot of patients with COVID over the last year or so, and some of them are not very ill, and some of them are extremely ill. And so it's been really tough on people in the sense that we've seen probably a little more death over the last year than we've seen in the past. And so emotionally, it's been tough for people. And putting PPE on and taking it off, that takes more energy. But we've done a lot of great things as far as setting up our environment to make it as easy for people. And we've also hired extenders to kind of help with making sure that we have the supplies that we need, assisting, people wherever they can. And we've also hired some what are extender nurses that have really been able to take some of that load off of our nurses at the bedside. So
Nurses are a big need in the emergency department right now. And
absolutely.
this isn't a position for a nurse right out of school. You're looking for experienced nurses. You mentioned that wide range of patients, and of course, it's important. So tell me about the type of person you're looking for.
Well, currently what we're looking for is someone that has at least a year's experience of being a bedside nurse, someone who is highly motivated, isn't afraid to work hard, is flexible, um, and really loves to take care of people. Because sometimes the patients that we care for, like you said, it's the worst moment of their life by coming to the emergency department. And you really have to be able to have some empathy for the person, no matter where they came in life, what part of life they're in, and be able to work with pretty much every type of patient. So
What's the most rewarding thing about being part of the ED team? Because you said 1992. Obviously, you love it. So there must be some big rewards.
well, I will tell you, the rewards over time for myself have been different. But for nurses, it's being able to make a difference in someone's life. It's learning all the things that you learn. For myself, initially as a bedside nurse, it really was making a difference in someone's life when it was the worst day. Being able to talk to parents when their child is critically ill, being able to kind of help them have a little bit better day because you're able to listen to what their concerns are and be able to maybe help them through a situation. Um, there, I think as a manager for me, it's been also the people. And when I ask nurses in the department, why do they stay? And they tell me it's because of the team that we have and the great work environment, because people are really good about teamwork and working well together. And if somebody is having a bad day, people are jumping in and helping them. And I think that's really what keeps people here is probably the work environment and their team.
One of the things that we have talked about as we've kind of introduced our Facebook audience to different areas of the hospital is ratios. So if there's a nurse out there who maybe got away from it and is thinking about being called back, or someone who's considering coming over from another area, what kind of patient ratios? What's their day like?
Their day is always different. Um, and it's kind of funny. People always ask me about patient ratios. We don't have a typical patient ratio. Usually, I can tell you what it usually is. Usually it's 1 to 3 or 1 to 4, but it will depend on the type of patient that you're taking care of, because sometimes you will have 2 nurses for 1 patient. If that person is very critical, maybe you are doing ECMO on that patient. And so you'll have 15 caregivers taking care of that person. Or if it's a very bad trauma patient and you're having to give a lot of blood products, you'll have 2 or 3 nurses at the bedside. Other times when you're working maybe in the fast track area or the rapid assessment area, you may have 6 or 7 patients because they're very low acuity and those patients are turning over very quickly. But most of the time it's 1 to 3, 1 to 4 would be, I guess, a good ratio to kind of keep in mind.
The qualities of a good emergency room nurse. What would make a person successful and happy and rewarded in this job?
I think somebody that um, doesn't have to have routine. Okay. You can't want things to be the same every hour or have to be so organized, because really and truly, where you in the emergency department you work in, I tell people it's kind of organized chaos. And so you're going to have to be able to be very flexible, very team oriented, hard worker, be open-minded and willing to change, because the only constant in an emergency department is change. That's the only, I mean, I'll tell people the only thing I can promise you is that things will change.
Well, what I've heard from the people that I've talked to who work in our emergency department is that atmosphere of teamwork, of just kind of the flow and how they all work together. And a lot of them also speak to having an amazing manager. So, Suzanne, thank you very much for taking the time today to give us kind of a look inside the emergency department. And congratulations to you and your staff members who were able to complete their vaccination process today.
Thank you very much. Thanks a lot.
Absolutely. So if you're watching this and you're interested in one of these positions, or you know someone who might be, please go to nebraskamed.com/careers. And thank you for joining us today.